Welcome to Washington Unplugged. I'm Sharyl Attkisson. The 5 House and Senate committees responsible for drafting health care legislation have now each passed its own version. The Senate Finance Committee passed its $829 billion health care plan yesterday with the support of one Republican, Olympia Snowe. But what's in the bills and what does it mean for the so-called public option? Joining me from Capitol Hill are CBS News Capitol Hill producer Jill Jackson and Capitol Hill correspondent Nancy Cordes. Nancy just came back from a sit-down with the chairman of the Senate Finance Committee, Senator Max Baucus. Talk about hot off the presses. Here's a little bit of that interview.
Yes, the president called. He said, congratulations, good going, brother. Good job, brother. Way to go. And I teased a little bit, said, well, I wish you good luck on Pakistan and Afghanistan, Mr. President. He says, well, he laughed. He said, I'll take care of that. You just pass health care.
Is it nice to be?
So, Nancy, he's talking there about a brief conversation he had with the President Obama, for whom this legislation is, of course, critically important. Can you explain just briefly, first of all, who Senator Baucus is in all of this and why he matters so much?
Well, he matters so much because he's the only one of the 5 chairmen in Congress who have now passed bills out of their committee dealing with health care who can claim that he managed to get Republican support. As you mentioned, he got that one Republican on board, Olympia Snowe. No other chairman in the House or Senate managed to do that. And he's also important because he is now one of the 3 Senate leaders who will be in that negotiating room. It's just him, Senator Chris Dodd, who was the spearheader, if you will, of the other bill that passed out of committee here in the Senate, and the Senate leader, Harry Reid. They will be trying to meld these 2 very different bills into one. That is no easy task because one, his bill, Baucus's bill, has a co-op. The other bill has a public option, but they will be burning the midnight oil until they can fuse these 2 bills into one.
What did you learn in your sit-down interview that you just had with him?
Well, I learned that he's pretty confident that they will somehow be able to merge these 2 bills. In fact, I asked him, how do you do that? I mean, this is not a situation where you can split the difference. You either have to have a co-op or a public option in the bill. And here's what he had to say. Nor the other.
Well, actually, it's, I think, in one sense, a little bit difficult, but in a deeper sense, not that difficult, because we're all on the same page. We all want health care reform. We want to figure out a way to get health reform passed this year. Not just talk about it, but get it passed this year. And to get it passed in the Senate requires 60 votes. So we're going to be looking at all the different proposals, starting with the Finance Committee, because that's the most recent, and looking at the health provisions and adding some provisions help in the finance version, working together, totally together. There may be a couple other ideas that we haven't thought of yet, but the main goal is to get health care reform passed. We're all very much in agreement with that. And to get it passed, we need 60 votes. So we're going to put together a bill on the Senate floor that has a high probability of getting 60 votes.
Jill Jackson, I'm going to challenge you to try to explain something that I think a lot of people don't understand, even those who are following it very closely. First of all, do you know the difference between a co-opt and public option? But the second part of the question that I know you know about is there are different kinds of public options on the table. We're not just talking about one monolithic plan that covers everything. Can you kind of break that down for us in simple terms?
That's right. Well, the first thing people should know is that the co-op really answers critics who say we need to keep government out of the healthcare business. So the co-op is a state-run insurance nonprofit cooperative. It would, in theory, be owned by the people who pay for their policies through these co-ops, and it would not be run by the government. The government would put money up front, but at the end of the day, government would step away. Now, the public option is the government-run plan. There are 4 committees have passed the public option, and the biggest difference between all of them is how doctors, hospitals, providers are reimbursed or are paid for, how the government pays them for their services when they give a service to someone who's in the public option. It gets complicated from here, but essentially the Speaker of the House would prefer something that would set things at a set rate tied to Medicare rates, and the Senate Help Bill and other House bills that have been proposed also prefer to have the government negotiate rates with the providers, and The big question is, at this point, is which costs more, and they're waiting right now on the House side for a CBO estimate to find that out.
All right, let me get from each of you what you know about whether there is, how much support there is for a public option in the end and how much is needed in the Senate and the House side, because, you know, we keep hearing so many things. It's in, it's out, it's critical, it's going to come out in the end. What do you think?
Well, I've heard the death knell being sounded for the public option many, many times here on the Hill, and it has never come to pass. And I think it still has a lot of life left in it, and that's because in the House there are more than enough members of the Democratic Party who support it. So in the House, it's really a given that the House bill will end up with a public option. It's here in the Senate where that gets dicey because they need 60 votes in order to pass health care if they plan to do it in the normal way. And that means they need to get every Democrat on board. And there are still some Democrats, a good handful from more conservative states, who are waffling or have flat out said they don't like the public option. Now, could they be convinced? Could some form of the public option that hasn't been put on the table yet entice them? Senator Baucus just said when I sat down with him a few minutes ago, there are all kinds of public options. So if they don't like one kind, we can come up with something else. So I think it's an idea that's still very much alive.
Well, and there are in the House, it certainly won't be easy. But the Speaker has said there will be a public option in the House version, and she's going to fight for that. Now, her strategy at this point is getting the strongest public option they possibly can, so that after the House and Senate have passed their bills, the House will have the best leverage to try and get a strong public option in that final product.
All right, so someday, and maybe you guys can tell me about when this might be, the House will have a bill passed by the full House, the Senate will have a bill passed by the full Senate, and presumably they then go together in conference where they work out differences to come up with the final bill. Can't a lot of changes, whatever's promised now, whatever we think now, can't all that kind of be thrown out the window in those private negotiations that go on at the last minute during the conference committee? Isn't that what we really will have to pay attention to in the end?
It absolutely will change time and again, and that's why we look at these numbers that predict, oh, the bill will cost $827 billion, or, oh, it'll get 29 million more people onto the insurance rolls. And you can't take those numbers to the bank because these bills are changing all the time.
And last question for Jill. Will we have a chance, we the media, we the American public, and members of Congress, to read a final bill? Will we have time to do that? Will it be shown to us before members of Congress take a final vote on this?
There's a major movement in the House to force that to happen. There's been a discharge petition filed. Members are signing up for it and want that time to read the bill. Speaker Pelosi told us just last week that she supports giving the public 72 hours to read the bill. At the same time, I think at the end of the day, this is going to come down to how close to Thanksgiving or Christmas, or how close are we to some major deadline and when they have to get something to the floor so that they can accomplish this by the end of the year.
And last word, Nancy, are there people up there that don't want us to read the bill, that don't want us to have 72 hours?
I haven't heard that statement that much recently. I mean, one concern, of course, is that frequently when lobbyists or interest groups have gotten their hands on the document, they've found ways to turn language in the bill into, say, a death panel for the elderly and that kind of thing. So that is one thing that they're worried about when it gets out there. The other thing is that this language is really complicated. I mean, 72 hours is not nearly enough time to read this legislation. That might be enough time for the average American to kind of get through and digest a few pages. This is really, really arcane stuff that's hard to digest. So I don't think it's realistic, even if you get 72 hours, that you could really make sense of what's in this legislation.
Well, typically what happens, I think we all know, something gets passed and then we start hearing for weeks and months afterwards about all the things that were tucked in there. So
absolutely.
You guys are terrific. Thanks so much. Jill Jackson, our producer up there, and Nancy Cordes, correspondent.
Thank you. Sure thing.
That's it for Washington Unplugged. You can catch us every weekday right here at 12:30. Thanks for watching. I'm Sharyl Attkisson. Also, check out my Follow the Money reports on the CBS Evening News with Katie Couric. We'll see you next time.